Hello, my name is Lillian Dawit. I am a second-year internal medicine resident at the University of Southern California. Here I would like to present to you a case of a very unique initial presentation of a man with what we found to be was metastatic hepatocellular carcinoma. Here is his story. A 55-year-old Chinese male with chronic hepatitis B presented to our emergency room with complaints of progressive swelling at the anterior scalp after reportedly hitting his head on a car door 5 months prior. He told us that about a week prior to his presentation, his acupuncturist attempted to drain the swelling with scissors, but the procedure was complicated by bleeding and pain, so he subsequently came to us for further evaluation. A CT of the head was performed and showed a massive 8 by 7 by 7 hypervascular mass centered within the right frontal calvarium, causing mass effect on the right frontal lobe, highly suspicious for metastases. Further workup revealed lesions in the liver, the cervical spine, lumbar spine, and paraspinous soft tissue, all concerning for metastatic disease of unknown primary malignancy. A CT-guided lumbar vertebral body mass biopsy demonstrated pathology consistent with HCC, or hepatocellular carcinoma, supported by immunohistochemistry. Neurosurgery performed embolization of the hypervascular cranial masses, followed by a left craniotomy for tumor resection, as more mets were found there. The patient subsequently underwent a liver biopsy, confirming well-differentiated HCC on pathology, and he was then started on chemoradiation therapy. Unfortunately, eventually the metastatic disease progressed on fourth-line therapy, with lesions arising over the sternum, scapula, ribs, and iliac bone. The patient most recently presented to the emergency department 2 years after initial presentation, with weakness in his bilateral lower extremities, with imaging showing diffuse osseous metastatic changes throughout the thoracic and lumbosacral spine, causing severe epidural spinal cord compression, as well as cauda equina syndrome. After discussion with medical oncology, radiation oncology, and neurosurgery, the patient decided against further intervention and was discharged on home hospice with dexamethasone for symptomatic relief. Hepatocellular carcinoma is the fourth leading cause of cancer-related deaths worldwide. Most risk factors for the disease, such as viral hepatitis and alcohol overuse, are largely preventable, but the underuse of surveillance techniques has limited early detection and treatment of the disease, leading to later stage at diagnosis and worsened survival. HCC common metastasizes silently via direct extension, hematogenic spread, or lymphatic invasion. However, in rare cases, the metastases can be found in less common locations. This report highlights a rare case of HCC in a Chinese male with diffuse extrahepatic metastases to the calvarium and sternum, resulting in grossly visualized manifestations of the metastases, as seen in these photos, as well as progressive spinal lesions causing compression of the cauda equina nerve roots. Though prior studies have demonstrated HCC with diffuse bony mets to the vertebrae, this is the first known reported case of HCC presenting with concurrent calvarial and sternal metastases. This case ultimately emphasizes the aggressiveness of late-presenting HCC and its metastatic potential. Thus, surveillance and early detection of HCC in patients with known risk factors is of utmost importance. Thank you very much for listening to my presentation and my case report. Have a great day.